We're going to talk about ankle sprains today. Remember, this is all for Operation Underground Railroad. If you find this video to be useful, or any of our other ones, you find it to be helpful, please go to Operation Underground Railroad and make a donation. We're talking about ankle sprains. Ankle sprains are so common. It's one of the most common things I treat in my office. I work in downtown Salt Lake, see a lot of athletes, a lot of high school folks come in with ankle sprains, weekend warriors. Usually when we're talking about an ankle sprain, we're talking about a mechanism of injury where the foot rolls underneath you like that. You can roll the other way in an abduction, eversion motion, but it's more rare. It's usually inversion, adduction like that. When that happens, all kinds of stuff can happen. You can tear the calcaneal fibular ligament, the anterior talofibular ligament, both of them. You can stretch them. All kinds of bad things can happen. You can also rupture the perineal tendons that run clear down on the side of the fibula down to the fifth metatarsal and below. You can damage cartilage deeper in the ankle. Some of this stuff shows up immediately, some of it shows up later. It's kind of a tricky thing. So that's the mechanism of injury. When it does happen, if you end up in Instacare or an ER, I always tell people, get an x-ray. You need an x-ray. I can't tell you how many people come in here and say, I rolled my ankle, I thought I was fine, and it turns out they broke their fibula, their ankle, or their fifth metatarsal. Get an x-ray, make sure that didn't happen. What's really hard is sometimes you'll get a stress fracture, a tiny little micro crack in the bone. And if it's small enough, you may not see it initially. You may not see anything. But 2 or 3 weeks later, the body starts to heal. You'll see a little ball of calcium forming around the fracture site, and it can become more obvious why you're still in pain. So get x-rays before, initially, and then several weeks later to make sure nothing's broken. That's important. MRIs can be done. I don't find that they're super useful initially because they're so expensive and they rarely change the treatment plan unless something really catastrophic has happened. I would say 95% of the time you don't need an MRI right off the bat. So x-rays, ultrasound can be useful. If we feel like there's a tendon that's ruptured, if toes are drooping, you have weakness, you've got a dropped foot, or something seems off, an ultrasound can help make sure that the tendons are intact. And at that point, if we really think there's a rupture of a tendon like the Achilles, then sure, we'll get an MRI and make sure we're okay. So ankle sprains, often you're going to have a lot of swelling around the ankle, a lot of bruising right around the fibula, a lot of swelling. Initially, it's the old rest, elevate it, ice it, 20 minutes on, 20 minutes off. Apply compression. An ace bandage wrapped in a figure 8 around the ankle can be useful, and get off of it and rest. Go see a doctor, get an x-ray of the foot and the ankle, make sure nothing's broken, and go forward from there. Initially, a couple of things you need to think about. If you have a bad sprain and you tear these ligaments, or you even just stretch them or attenuate them, if you do that, your ankle's going to be floppy for the rest of your life if you don't try to get it to heal in a shortened, secure position. So the best way to do that if you've had a significant sprain is to use a cam boot. It doesn't have to be this exact type, but it's got to be tall. There's a lot of really short cam boots or cast boots are out there that I see dispensed at Instacares and ERs, and they're horrible. They don't limit the motion of the ankle like we need. They may work for small ankle sprains, but for the most part, they don't serve much purpose. The foot and ankle surgeons around here in the Salt Lake, Utah area, we had a meeting a few months ago, and we actually voted to get rid of the short ones and all of the Instacares and ERs that we had any control over, because they're just not very good. I have a lot of people come in with these little short guys, their ankles moving around like crazy, and unfortunately they have to get a big boot anyway to heal up correctly. So if it's a bad ankle sprain, you want a big tall boot. The real point of this is to hold that ankle at 90 degrees. If you can hold it at 90 degrees and avoid inverting or everting too much, you're going to give those ligaments the best chance possible of healing in a shortened position. If they heal lengthened, you'll be in my office or somebody else's office saying, "Doc, I step on a pebble, I roll my ankle easily all the time. Now what?" Now we're talking surgery, and we have to go in there and do what's called a Brostrom Procedure, where we shorten up the ligaments, we overlap them, and try to keep that ankle from being so loose. So that's really important. I forgot ankle braces. Initially, if it's a small sprain, and it seems like things are stable and doesn't seem to be anything torn, an ankle brace is fine. I like 2-strap ankles or 3-strap ankle braces that come down both sides of the ankle and then wrap around in a figure 8. That construct, this one's by Bioskin. It's called a Trilok ankle brace. That's great. It's going to limit motion. If it seems like there's instability or there's so much pain and swelling in the ankle that you can't really test and see if the ankle ligaments are intact, then I would definitely go for the cam boot. If in doubt, put them in a cam boot. It's so much better. If you're a patient and you take a few steps in this and it really hurts, ask for a cam boot. That would be my recommendation. If you go too far down the road with a very loose ankle and you keep rolling your ankle time and time again, what's going to happen is not only are these tissues going to become very scarred and difficult to work with in surgery, but you can also damage the cartilage deep inside the ankle. If you look inside the ankle, you've got your tibia, your fibula, and your talus. The talus, for whatever reason, is usually the one that takes the beating, and you'll see these little potholes in the cartilage on the shoulders of the talus or in the middle. The cartilage may have taken a beating recently or years before, and you get a little hole in the cartilage and the bone underneath becomes soft. It's called an Osteochondral Defect, an OCD. If those get big enough, they can be quite painful. A lot of people describe walking around, they'll feel fine, they'll line up their ankle as they step in an interesting position or in a unique position or just an average position. They'll have severe pain that might bring them to their knees, or they'll fall down, or it just really hurts. You may if you're experiencing that, you may have an OCD, or you've got synovitis, little tentacles of scar tissue that have formed and are kind of hanging inside the joint, which might get pinched from time to time. Either way, that can hurt like crazy. That may show up months or years after an ankle injury. And so if your ankle isn't getting better within 4 to 6 weeks, 8 weeks, and the pain is really consistent, and you've been icing it and putting it in a boot, it's time to see a doctor and see what's going on. So those are some things to think about. Other things that can go wrong, I mentioned the perineal tendons before. There's 2 of them that piggyback right behind the fibula and attach either on the 5th metatarsal or further down on the bottom of the foot. When you roll the ankle, those get stretched. They don't usually pop end to end. They don't usually tear like that. But what they love to do is tear linearly and split. Like you've cooked a hot dog too long, they'll split lengthwise. And because they're so tight and they're under so much tension and motion, they use the back of the fibula as a pulley system. There's so much tension on there that if they're torn, they rarely, if ever, fix themselves. In fact, I've watched through serial MRIs, I've watched little tears get bigger and bigger over the years. You want to get to those and fix those if they're symptomatic pretty quick. If it's been a few months and the pain is still there, I recommend fixing that before the tear becomes too long, because what will happen is if a tear is really long there, the tendon behind will come through it and everything starts to scar down. And I've done cases in the O.R. where I can hardly identify one of the 2 tendons or both of them, and they're in pieces and they're attached to the tendon sheath, the covering around the tendon. And it becomes virtually impossible to have 2 functioning tendons or even 1. You end up sewing everything together and praying it acts like some kind of strong strut, but the functionality is largely gone. So things to keep you up at night, watch for that. That's something you want to have fixed sooner than later. So ankle sprains, it boils down to early intervention. Get that foot at 90, ice it, elevate it, get off of it, get an early x-ray. Go back to your doctor after a few weeks if it's not getting better significantly. Within 6 to 8 weeks, if you're not significantly better, get another x-ray If that's not working, it's been a few months, it may be time to get an MRI. And in the MRI, again, we're looking for problems with the cartilage in the ankle. We're looking for torn and lengthened ATFL or CF ligaments. We're clinically looking for an unstable, weak ankle, and we're looking at those perineal tendons to see if they've been ruptured and torn and if they need to be repaired. And that is ankle sprain basics. Your local podiatrist, your local foot and ankle orthopedic surgeon, they're both great. Go see one of them, check out their reviews online, make sure they're high quality, and they should be able to take care of you. Thank you very much. Don't forget, this is all for Operation Underground Railroad. Go make a donation. Please subscribe to our channel. Every click, every view or a subscription helps us earn money for Operation Underground Railroad. When 100% of what we earn goes to them. This is all a volunteer service for them.